Hey, I want to take a few moments today and begin by introducing to you guys Dr. Matt Angove. Angove Family Medicine in Centralia, Washington. I want you to know what a caring and just a very well-rounded influencer in the medical community, has helped our family and many around us so much through the years. And he and I were having an email dialogue that I just asked him, would you be willing to just do a video interview today around COVID, variants, and vaccines? So Dr. Matt, welcome today, man. I'm glad to have you.
Hey, thanks so much, Dwayne. Super glad to be here. Super good to be here.
Well, it's a joy, man. It's a joy for me. And as you and I were just talking before we began recording, such a hot topic, such a divisive topic today, whether it's COVID and vaccines, with mandates being handed down, conspiracy theories flying on social media. I feel compelled to get what we know as truth out. So, one of the things that you shared with me, and maybe we'll just begin there and then you can take it wherever you like, was that the vaccine really doesn't keep you from getting the COVID virus. You want to talk a little bit about that?
Yeah, for sure. Yeah, so there's something called sterilizing immunity, which is essentially where you got, say, a vaccine or some therapy, and you no longer could get it, and you no longer would essentially give it to anybody else, that pathogen. And I think this is one of the most commonly misconstrued and, maybe put out there things, is that the idea that, so get the vaccine, don't get the vaccine, doesn't matter. That's whatever you feel in your heart to do. But the idea that maybe you're doing that, you're receiving this therapy to help somebody else, that, you're receiving it to help your children, you're receiving it to help your wife, you're receiving it to help your grandparents, your coworkers, your employer, whoever, when that is not true. The only reason we would get the therapy is to help ourselves potentially, decrease the risk of, say, hospitalization or death because we received one of the current vaccines available. So I think that's the biggest thing, is we can still, which this is not me making this up, this is not my opinion, this is not, this is my experience. I've experienced this with tons of patients, this very thing, but this is, in the FDA papers, this is in the Pfizer papers, this is in Moderna papers, these are in J&J papers. CDC puts this on the website. WHO puts this on the website. It's everywhere. This does not stop spread. Even the guy that that created the mRNA vaccine says that this is not what they're meant for. This they don't do this. They don't stop spread. They don't stop you from getting it. And I got plenty of patients who have had the vaccine and have gotten COVID. I got a bunch of them right now. Some have, bad situations. Some have an easy situation, similar to people that have not got any of the shots, who some have had a really terrible situation, and some have had, essentially nothing happen to them. So it's, I think that really is, if I was to give any message to anybody related to this whole thing, is because there's so much pressure, peer pressure, employer pressure, job pressure, related specifically to these shots, as far as what we know right now. And it will be this way indefinitely, because it's a coronavirus. There is no end to it. It is with us forever, indefinitely, until the day we die. This strain, the SARS-CoV-2, is going to be present. It'll be a bunch of different variants. It'll become endemic as opposed to a pandemic soon enough. A lot of people are theorizing within like the next year and a half or so, it will just be endemic. The strains won't be super problematic, and whether you had the vaccine or not, you're probably going to be. It's just going to be like any other coronavirus. Unless there is, there are conspiracy theories out there saying other crazy stuff. But as a general rule for coronaviruses, that's what they're going to become. It's going to become, endemic like every other one. And we will all probably have SARS. We all will get SARS-CoV-2. I think that's the other thing.
Okay.
Whether you got vaccinated or not, you're going to get it. That's just how it is. At some point, whether you got it, initially, and probably would have had, the original version tends to be the most problematic for people that have not had it before. That tends to be the most problematic. Okay. But so that was the alpha version. Now we're, Delta, Gamma are kind of the ones that are out there now. if history goes along like it does in viral activity, then with each passing essentially mutation or variant, it should become less of a problem. Doesn't mean, I mean, if we test all the time, yeah, you're going to see people forever until the day you die. We can just keep testing people, and people are just going to keep on showing, oh my goodness, there's 1,000, there's 10,000, there's 1,000,000 people. All these people are testing positive, but which, like we can see right now across the board, like the number of people getting it aren't really changing. It's the number of people that are hospitalized and dying that's changing drastically. So it's
right.
Yeah, I think that's what does that make sense as far as like spreading and potentially being able to receiving it?
Yeah,
it's not sterilizing immunity, and that's not opinion. That's known fact. Every hopefully medical professional out there, every medical organization agrees to that. Every virologist agrees to that. And then of course we have a lot of studies now showing that the concentration of viral particulate in the nostrils and the pharynx of a person who's been vaccinated, a person who's not been vaccinated, essentially is the same. And then based on the variant, maybe vaccinated people have a little bit more on the Delta variant side of things as far as concentration of viral activity in the sinus cavity, because it's a respiratory virus, right? It's not like hepatitis B or like HIV or something, which are not respiratory viruses. So we give a shot, it goes into the blood, it doesn't come up and show up in our nasal passage and shut it down there, which is why people are just going to continually pick it up in their nasal passage. That's also why, a person with natural immunity, they got COVID and their body created a response, got the antibodies, got the T cells, right. That memory created, they seem to have actually a better, they do have a lower viral load generally on, like if you got it, say if you got the Delta, you got the Gamma, you got one of these later on, these other variants, like the chance of you actually noticing that would be almost zero.
Really? Okay.
Because you've created this robust like the whole like sphere of the virus, you've created an interaction, a knowledge in your body of, as opposed to just basically a singular spike protein information input via the vaccine. That doesn't mean the vaccine isn't helpful for people. It's just you would take some natural immunity over a vaccine, if you've already gone through the experience of that.
Okay, so for me, I went through it back in November. I had a very difficult time, difficult time with it.
Yeah.
I should at this point now have natural antibodies built up. My body has done its job to protect me from Delta, Gamma, or any of the other potential variants.
Yeah, I mean, you literally are you're as good as it can get. Wow. There's they're promoting a lot of boosters right now, but that is all hypothetical. That's not of any. There's no known like research benefit to that. That is hypothetical. Could it potentially benefit you more? Maybe, but nobody knows. But yeah, I would. I haven't tested myself. I'm pretty sure I had it back in May of 2020. Kind of a lighter version, but I feel 1,000% confident. As confident as I could be that, man, yeah, I would be doing great. I would just follow, whatever you would follow to decrease your risk of generally getting sick is what I would continue to follow. Right. Those hygienic processes and all stuff are still totally a good idea to do. Right. But yeah, I would feel super confident. I would feel like, wow, yeah, I should do great.
That's and the email responses that you gave to me, that was one of the highlights for me, of course. It's like, okay, I had a very significant sickness myself. And so it's like, okay, I have the natural antibodies, and I just heard you say it's as good as it can get. Yeah.
Well, yeah, so far, all the studies they've done on people from the beginning who had COVID are showing that literally the deepest parts of your immune system are demonstrating that, yeah, this is going to be reciprocal. It's just going to keep on turning over this knowledge indefinitely, which is huge. Yeah. I wish people would talk about it more, because there's so many people running scared out there thinking I had COVID once, man, it's going to come and hit me, full bore again. Who knows when? It's
Right.
like, no, it's feasible. There are people that have got COVID again. But that is like, 1 in 100 million, it's just so teeny.
Yeah.
So.
Yeah, and I've heard that one time somebody told me that, yeah, I had somebody who got COVID and then got it again. But again, was the first one even tested? I don't.
Right.
I've heard of one case of it anywhere at all. Now
Right.
I have,
Right.
personally, it's struck very close to home for me. Mom and dad both got vaccinated. My older sister did as well. Dad failing health, dementia, frail. And they all three got COVID, and my father didn't survive it. So, my father passed away. And that's really one of the things that set me, okay, let's go look at this. My dad was afraid of COVID.
Sure.
And it's a good idea to get. I know they got 2 shots, so I know it wasn't Johnson and Johnson. I don't know which one they got.
Yeah.
But there was no protection there as far as them getting COVID, and they were both rather ill. My sister was as well. They both recovered. So that's very close at home for me.
No, for sure. Yeah. I mean, I've lots of patient stories, just like that. And I would say there's a really interesting interview from I think it might be just like a nutritionist, but he does a lot of research on this whole COVID thing, and talking about the basically psychology of COVID and the impact on, that like literally fear has on a human being. And that, there is that whole psychosomatic response to something, which is 1000% real. I literally see it every day in the office.
I'm sure.
And if you think something is so horrible and so detrimental and is going to get you, the likelihood of that thing being so horrible, detrimental, and getting you, that's at least 50%. That's a 50% higher, because placebo effect itself is 50%. So wow, the necessity of understanding what's going on and realizing that COVID is a real deal. It's hurt a lot of people, and we need to be vigilant in making sure that our being has the best essentially weapons possible and availability to that. But at the same time, not living in fear, like it's coming for me. Where is it at around, which corner, which person might give it to me, these kind of things, because that itself is deflating our immune system. And that is like, you can verify that by blood, that different inflammatory cytokines are high now and other ones are low. Anti-inflammatory ones are low when a person is in a state of fear and fret and worry. So it's, I think it's a big deal. It's just completely overlooked because, you can't stick a needle into somebody to change that. So
that's pretty amazing, because when you start talking about fear and just getting the facts out, that's the reason for this interview, and I am so deeply grateful that you were willing to do this. Sure. I think of scripture. Scripture says that fear brings torment, right? And then I just heard you say, if I'm running in fear, I have just increased my chances of getting it, literally. And you're talking about from a medical perspective. Am I correct?
Literally. Yeah. So I would say the manifestation of it it's going to be higher. If, that so many patients who've had, I would say, really tough times with it. We had to use like some steroids and stuff with them and that kind of thing. Very, very close to going to the hospital. The number one thing, especially these 2 gentlemen told me, was literally they just realized how essentially afraid they were, how much, it was like they could breathe. Actually, they could breathe even, and their oxygen levels would be fine, but they were just so seemingly from all the inputs from the outside were just afraid. And knows, wow, like how I was thinking about this was making a way bigger difference than literally what my oxygen levels were at, or my what was actually happening in my body physically. And once some words and some voices got into their life, that actually seemed like the thing that got them out of the situation, because their physical body wasn't. They weren't going to go. They were okay. They were in a tough spot, but they weren't going to die. They weren't going to be ventilated or anything like that. Yeah. So I think, it's a big deal. Big deal.
That's the first time, I think, at least that I can remember, hearing that fear base being tied so clearly to medicine and science.
Oh yeah.
And that's a big deal. I think about out of Job, right? In the book of Job, the scripture says that the thing that Job feared fell upon him, right? I mean, so that's,
I think about that verse all the time.
do you? I mean,
Oh, yeah.
I'm hearing that, and yet it seems like fear sells today.
Oh, 100%.
Right?
100%.
Yeah, and so many people are afraid. And then when they don't have truth, and there's these goofy websites out there that are sharing information, and then people are resharing this stuff on social media, our ability to trust, to me, seems to greatly diminish.
Oh yeah.
You know?
Oh yeah.
Yeah.
Well, yeah. And then if you get, if you get inundated with enough of this thing, whether it's truth or not truth, eventually it becomes truth to you. I have conversations with people all the time that I would say, like, I would want to gather wisdom or understanding from them in a lot of things.
Yeah.
And they tell me things about this whole COVID experience that I think, man, that's just, it's not like an opinion or a hypothesis. It's so factually incorrect. But on both sides, on both sides. And you think, man, if we hear things too much, that's why we always have to be so cautious about what we give our ears to, give our eyes to,
right.
Because man, everything is about, getting our eyes turned so we can somehow make, if there's more, you spending more time on whatever you spend more time on makes more money for whoever you're doing that for.
Right.
Right. So we got to be so careful. That word vigilance, I think, is big time these days.
I think it is. I really agree. So coming back just a moment, you mentioned a guy in an interview on psychology of it all.
Yeah.
Is that a link we could provide?
Yes. I'm I'm completely blanking on his name. Right. I would send you that link. I'll send you that link. Okay. But yeah, it's great. It's about 12, 13 minutes. But he does a really good job of breaking down what may be the second leading cause behind like obesity and diabetes and those kind of things, as far as what's leading people into hospital situations and tough times.
Yeah.
Because that's what I say a lot. You think about these hospitals and the people. So if a person gets tested positive for COVID, literally, within seconds, they're calling our office up. They're wondering if they should go to the ER, if they need to go to the hospital. It's like, no, you don't need to do that. You just, like, my main role really is, sure, we give nutritional interventions and all that kind of stuff, or medications if necessary, but is to calm them down and help them understand that, their risk is so excruciatingly teeny. The likelihood of them needing to be hospitalized or dying from this or ventilated, it's so excruciatingly teeny. It's not that there isn't too many people that are going to the hospital and dying of it.
Sure.
But if you take on an absolute scale, it's, it's less, it's like, I forget exactly because I don't want to say that, but it's like 0.78%. It's just so excruciatingly unlikely that you're going to end up in that position. Even though I've had patients end up in the hospital, and I've had a couple of patients ends up on ventilators. But just because there's that patient, easily 99.9% of my patients have not ended up in that situation, or been to the hospital. Right. The fact that I can count on, on one hand, people that ended up actually we thought maybe you should go to the hospital. But all these people are, charging into the hospital because I would say of fear mostly, not because, they have a blood clot or their oxygen levels are super low, or they, can't breathe kind of thing.
Right.
But just because they've been flooded with the idea that death is imminent if you get this thing, right?
Right. And again, that's the selling of the fear, unfortunately. And that's I hate that, because we as people of faith in Christ, we're to live a life of faith, right? Yeah. And faith comes by hearing, right? Hearing by the word of God, Romans 10:17. And that's what I tell people all the time. What are you filling yourself with?
Yes.
Right. Yes. I think that's important. I'm a guy who my entire life grew up watching the news. 5 o'clock news was a ritual for me, right? Until January of this year.
Wow.
I just looked at my wife and said, I'm done.
Wow.
Watched both sides of it. And, we have the people that, hey, I only watch Fox News. Well, they're just as twisted,
Oh, you know it. You know it. You
and
know
they're
it.
and they're selling things in the end because it's a monetary driven business. And so for me, I shut that off, and literally no side effects, no missing it, well, good side effects. I mean, I'm no longer running by these conspiracy theories and stuff. And that helped me immensely. Right.
Yeah.
And
Huge,
so then I, in
huge.
terms of talk to other people about it, I said, what are you said it, what's getting in through your eyes and through your ears on a daily basis? Really good. And really on the same token, I know you are much more about, preventing issues by the way we live in a health environment. What are we putting into our bodies?
Yeah. Yeah. Oh, definitely. Definitely. Yeah. I mean, health accumulation is my mantra. That's what I try to preach. That's my preaching platform.
Yeah.
Is, just the compounding effect of these little decisions we make day in and day out that, by themselves, that one little decision, that one little meal, it's kind of meaningless in this grand scheme of things. But, most of the time that one little meal keeps, it happens more than once. We have our routines. We have, say the 5 o'clock news. Watching the 5 o'clock news isn't going to do anything one time, likely. Right. But the next, if you got a year, 10 years, 20 years of watching it, there's these seeds that are put in there. So I'm a massive proponent. And I think that's one thing I tend to get on a soapbox about over, so the 18 months that we've known about this whole SARS-CoV thing. Right. And, what population is at greatest risk of issues. And so we have the older, 80 plus, they're definitely at a higher risk just across the board, no matter how healthy you are. An 80-year-old, you're definitely at a higher risk. But amongst all that, the huge risk is for, the obese population, the people with type 2 diabetes, with these metabolic syndromes.
Right.
And these are not, those aren't just like, that's how life is and you can't do anything about it. It's challenging. I'm not saying it's not challenging. I'm excited with these people all the time. It is challenging. It's like the hardest thing ever to change lifestyle habits, transform lifestyle habits.
Right.
But I do think if for 18 months, if 90% of the information was, wow, we do these lifestyle habit tweaks, and this is, we're going to decrease the risk of death from SARS-CoV-2. I literally, say 500,000 people have died in the United States from SARS-CoV-2, somewhere in that realm that's suggested. I would put good money on, at least 250,000 of those people, if not 400,000 of those people, would not have been in that situation, because at least 400,000 of those people were in a obese category, were in a type 2 diabetes category, were in, they already had this raging inflammation in their body. And all of that is, literally by some of the simplest measures, food, activity, sleep patterns, some stress support could be mitigated.
And that's not, and I think that's what really gets to me. That's not talked about.
Right, at all. And you think, why is that not? If we are truly, if your overarching entities are truly about saving the individual lives, creating prosperity in the individual person, then we would be plastering that everywhere. But of course, it's often either you're turned off, if you're on the social media outlets, or you're ostracized if you're in the medical community, or they come and say we're gonna put some damper on your license or something. It's just completely wild. For anybody that will listen and you're concerned about SARS-CoV-2, either you haven't had it, or or you have got the vaccine and you're still kind of scared because they're still telling you got to wear a mask everywhere, you got to isolate, you got to be 6 feet apart, all these kind of things. You can create great confidence in your body by I'm going to start that exercise. I'm going to start that walking routine. I'm going to start, going to that Pilates class. I'm going to start, I never drink water. I always drink soda pop. I'm going to start swapping out my soda pops for water. These, I'm going to decrease my alcohol intake. I'm going to start, eating more vegetables, or eating meat in place of my potato chips. I'm going to start doing these things because I'm going to empower myself. That's, let's empower ourselves. We're totally capable of it.
Yeah.
And it's totally available to us.
Yeah.
We don't have to just keep waiting for the next booster, the next booster, the next booster. That's the only way of surviving. There's all these people that are not doing that, basically is what I would say. There's all these people that are not waiting for the next booster. They're out there. I get some patients, literally raging type 2 diabetes. And in the 18 months, they don't have type 2 diabetes anymore. Like there's nothing about their body to suggest they've lost 50, 60, 80, 90 pounds. And they literally are an entirely different human being, and their body's capacity to withstand, the inflammatory storm that would be any viral infection, even the flu, whatever you name it, is insanely better. And of course, there's people on the other side who haven't done anything and are continually being inundated with that information that the only thing you can do is wait for the next shot to help yourself out. And that's just not true. Shot or no shot, you want to do these other things. And even if you get the shot,
yeah,
the likelihood of it helping you, if you are unfortunately obese or type 2 diabetic or any of these lifestyle metabolic issues, the likelihood of it helping you is very, very low. They're showing that like you're not even creating the antibodies for it. So no matter what, these lifestyle interventions, it's kind of, to me, it's always cool because it seems like with almost any intervention that's which I do medical interventions, I give medications, we do everything. Whatever a patient needs is what we do.
Yeah.
But everything always works better when the lifestyle stuff, the stuff that we personally have the power to do.
Yeah.
When we do those things, everything works better.
Wow.
Which is awesome.
Yeah.
Because then it says, hey, I can do something about this. I don't just have to wait for something outside myself, government, my doctor.
Right.
I can do something myself.
Yeah.
So
I think that, again, it's unheard of. And to hear you say there seems to be some repercussions for those that are carrying this message, whether it's ostracized, in a particular community or off of social media. And I find that so unfortunate because I'm just thinking personally for Jan and I,
Sure.
and I want you to know you've changed our life.
Oh,
praise
the Lord.
Yeah, awesome. You really have, because you opened our eyes to some things, and like soda pop or diet soda that I remember that discussion very clearly. But again, just becoming aware, because in our community, hey, diet doesn't have any sugar, it's better for you,
100%.
blah, 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 right? And you got us connected with the Zevia Natural, and literally that's the only soda pop in the house now, unless the grandkids show up. I have to be completely honest.
Full disclosure.
Full disclosure, but you've helped so much just in that way, and even right now you're helping me with some things. You've got me on a particular regimen, and that's why I just wanted to get your message out. I think it's a message that, especially in the church, I think everybody needs to hear it, but in the body of Christ, let's get away from conspiracy theories. Let's get away from thinking the government's going to fix all of whatever.
Sure.
And let's take ownership for our own health, spirit, soul, and body.
Right. Yeah.
It's huge. So thank you for that. One of the other things, and then I'll just let you share what you would like, but one of the other things you mentioned to me was you encourage any of your patients to stay away from anybody that has had a vaccine for like 3 weeks because of the shedding, if I understand that correctly, of the virus.
Yeah, it's one of those things that we don't really know about. We don't know what's going on. I don't understand it. And I don't think anybody else really understands it, but it seems like there's some phenomenon going on, whether it is, the idea of transfer or shedding, that kind of thing, that's hard to say. But, just in the last, I guess about 2.5 weeks ago, I literally had 3 patients call me up saying, man, I got all these basically COVID symptoms. And they weren't vaccinated, but one party had somebody stay at their house that had been vaccinated like 2 days earlier. The other party went and stayed in a cabin with a couple who'd just been vaccinated a couple of days earlier. And that was really their only interaction with kind of the external world. And then all 3 of them ended up with COVID symptoms. And all 3 of them ended up testing positive for COVID. And so, is that the person, these other people had COVID, regardless of the vaccine, and their symptoms were minor, so they didn't realize that they were then spreading it to all these other people? which in itself could be a problem,
Right.
and is a problem right now.
Yeah.
Or is it somehow, between the spike proteins that are present in the nasal passages and the feces and the urine from a person who's been vaccinated, that is somehow entering the body of these other people and causing the whole inflammatory response. I do not know. I'm not definitely not staking any kind of life, or that's just basically my thing is, yeah. So we don't understand what's going on quite with that. So I give myself a buffer. I got a lot of little kids. I'm like, yeah, let's just not, if we know somebody's just been recently vaccinated, let's just like
not be around it.
Yeah. We still love you. Let's just give it a little break. Just like if I had COVID and I'm not going to come like hang out with you right now. I'm going to stay home and we'll stay with our kiddos and make sure we're not spreading it to you, kind of thing. So that's my main thought on that.
Well, and thank you for that. I also, since we talked, or at least email communication, I have a friend that happened. They completely stayed away from everybody, quit traveling, made one trip to see their daughter and son, or son and daughter-in-law, and a few grandchildren, and they had all just been vaccinated. And the same thing happened. Immediately, they both were down with COVID, only interaction they'd had. And my friend ended up in the ER and in the hospital for like 5 days, so same kind of deal. And so again, I appreciate, kind of the disclaimer. We don't know what's going on there, but we know it is happening.
Right. Yeah. So I think it's best, just give yourself, you're doing all these other things, you might as well just take that off the plate.
Yeah.
Kind of like at the beginning of this whole thing.
Yeah.
I was definitely much more like, okay, man, we're not going to do Taco Tuesday anymore with all these families we get together with. We're going to let's just chill. We don't know what's going on. Coming to the office, every single patient's called ahead of time, making sure they don't have anything going on whatsoever. If you think maybe possibly the sniffles is COVID, then we're just going to hold off on it right now because we don't know. But, once, you get 3-4 months down the road, you're like, okay, we know what's going on. We've seen the patterns of things. And, we feel comfortable going back out in the world and expressing ourselves, kind of thing. So, yeah,
really, really, really good. So I know you and I here, we are in the state of Washington. People might be watching this from who knows what states, but we know there's been a mandate that's happening here, that's happening like with state employees, essential to be vaccinated. If people are facing that, I know one of the things that you had mentioned was, don't let an outside influence drive you to a decision, basically using my words, let it be driven by an internal decision, or this thing's never going to stop.
Right.
Say for guys out there that are saying, you know what, I need to get, I just feel like I'm going to have to get vaccinated. I have no other choice. So what would you say to those folks?
Yeah, that is,
is there a particular?
That's all my life has been the last, 10 days is trying to figure out what to tell people about this, or how to, I think the one thing to consider is okay, you get the shot, that doesn't leave your being. That's never going to leave your being. And so you just have to be 100% cool with that this is just, if there's side effects, if there's short-term side effects, or, side effects 5 years, 10 years down the road, you just have to be completely at peace with that. Otherwise you're going to regret, what you did. And at the same point, if you, I got some buddies who got, 7, 8, 9, 10 kids. One's got 11 children actually. And they're firefighters up in King County, up in Woodinville, Kirkland. And, they're told that if they don't get the shot, they lose their job. And so, 20 years is down the tube. And like, what are they going to do? They got these huge families, and all that kind of stuff. And, they're pretty adamant that they're not going to get it. And they're going to, and the funny thing is all 3 of these guys have already had COVID, and they all 3 got hit pretty hard with it. And they all have, robust immunity, because we've checked their labs and everything. So, which is, a whole nother subject of that's just craziness that they wouldn't be just, okay, you're good to go. But I think for the people that are in that position, I'm every healthcare worker in Washington State is mandated to have it. So I'm one of those people. You just have to know, you got to just don't look at any media. Don't go to any, no matter how Republican, conservative, liberal, Democratic,
doesn't matter.
don't go to those sources.
Yeah.
Find a source, and I can even send you some sources, things to look at, but
Thank you.
that is, has, I would say, like, no ulterior motive, no coercive motive, no pressure motive, doesn't already have a, because everybody's got their opinion on it. And I just, yeah, I mean, it's the thing that's so sad to me, the number of people and patients I have, they come in the office and they ask me to, like, can you help wash these spike proteins out of my body? Can you help me with this? Because I got the vaccine. I didn't want to get it, but the employer, whatever, said they're going to fire me if we didn't. Or, I get so many nurses right now who don't want to get it, and they're going to be fired. But yeah, these people, they want me to help them after they've received the vaccine, which of course I'm going to help anybody. I don't care if you got the vaccine. Like, well, what can we do? We know nothing to do. This is totally new. This has only been out 8 months max. There is no protocol. There is no research to say what you do for a person who's, because it's there forever. That's just how you've written a protein into essentially the exterior of your cell membrane, and that's how it's going to be. So you just have to be, I think you just have to be just at peace. You got to find, okay, what am I going to get peace with? Is you got to take care of your family either way. So there's I've listed a lot of messages on this from different pastors. I'm getting different views, and the thing is that some people are going to get it because that is the thing for them to do, and I think that's completely reasonable. I don't think you're getting the mark of the beast or anything like that.
Thank you for saying that.
My opinion on that doesn't matter either. But, in my personal opinion, I don't think it's the mark of the beast by any means. And I don't think there's, like, encrypted technology going into your body or anything like that. But yeah, I mean, so you get the vaccine, you end up with, say, I have a patient who had a stroke, and I have another patient who had an aneurysm, very closely linked to it. Another patient, a pharmacist, who had these ulcerations in their retina. All these are basically life-altering experiences for them that are shaking up how they can care for their families. Right. And so you have to basically be okay with potentially that happening, or on the other side, you have to be okay with losing your job and finding an entirely different way of caring for your family. And so either way, it does come down to you. I don't have the right answer for you. And I think that's a big thing is, I get calls all the time, people wanting me to give that answer for them. And to be honest, I can't be responsible for that. I don't want that liability on me. And it really isn't fair to you if I take that liability on me, because you have to live, it's your body, you got to live it out. It's your family. You have to, I'm not going to be caring for your family. You're going to be caring for your family in the end. And you're probably your fire department, your police department, as you can see, they're just okay, yep, I guess you're gone. See you later. They're not going to be caring for you. So you just have to decide and just be 100% comfortable. Go get that Holy Spirit word in your being. And the thing is, you're going to walk in with a peace that passes all understanding, and you're going to get that shot. Or you're going to, get that slip that says you're fired, and the peace that passes all understanding is going to guard your heart, and you're going to walk out of there. That's where you want to be. And it might take some work to get there, but that's where you want to be.
That's where you want to be. And that's it, right? That peace that passes all understanding given to us by the Lord. Thank you for sharing that. And I think that it is a very individual decision, right? Everybody has to make this decision very, very individually. And then you live with the results of it.
For sure.
And I really appreciate that. Just your heart in all of it. Thanks.
Sure.
Yeah.
I wanted just to bring up one, to help build people's faith up here a little bit. A testimony for myself. So I was practicing up in the greater Kirkland area for my first 5-6 years of my practice. And I was in with another group. And then there was something that happened with that group. And basically, I was told that I could not contact because I wouldn't sign on to another contract. I couldn't talk to any patients. All my patients were taken away. I had a couple thousand patients at that point. And so I went from one day, I mean, I was doing great, life's good, I'm taking care of my family, to literally the next day, I had 0 patients, 0 job whatsoever. And I was going on a trip to the Grand Canyon to go rafting down with my dad for his 60th birthday. And so I had basically 1 week, and then I would be back and like, I've got to figure out what we're going to do. And during basically when I was driving to the airport to go to the Grand Canyon, this guy that I used to personal train for when I was in medical school calls me up and says, hey, would you, he's a very wealthy person. And he says, would your family, I heard that, because my grandpa did his taxes, that's how it worked.
Okay.
He said, I heard your family is in, or you're like, you're out of a job, or you're going to you're starting a new clinic or something. And I was like, yeah. And he's like, would you be willing to come live with me? I'll pay you to live with me and cover all your food, all this kind of stuff, and pay me a good amount every month to come live with me and to help me. And so basically he has a very big house. So one side of the house, basically my family could live in, and he lives on the other side of the house, this single guy. And I'm like, whoa. So like about 16 months, we ended up living with this guy to basically do like a Biggest Loser kind of thing for him. All my bills are paid for. I have no bills whatsoever. In the meantime, I'm able to basically start my practice down here in Centralia where I am now, and, get things going. And then by the time I'm out of there, I had, plenty of patients and was able to continue to care for my family via, doctoring. So that to me, with my position too, it gives me just so much peace that, you think, man, how in the world could this work out? Because like literally it never passed my mind that somebody would call me up and ask me we're going to take care of you, everything just randomly. Right. But that's what God does. He just does crazy things for us. We don't deserve it. We don't know what's coming, but if we're kind of like, I feel like staying humble and just really just trying to seek him, he figures it out. And even when we're not, he still figures it out, it seems like.
He still figures it out, right? His grace. Thanks for sharing that. What a powerful testimony, because there's probably people watching this that are afraid,
totally understandable.
Right. And you're going, okay, what do I do? And that's, I think you said it well, get a word from the Lord. And so what I found is faith always trumps fear.
Amen.
And faith fuel is presence. And I find that I have the presence of the Lord through prayer. I have the presence of the Lord through his word. Amen. And then I have the presence of the Lord through the faith community that I'm plugged into. And if those three are functioning, and I know this isn't so much for you as it is for everybody else watching, if those are all functioning, then I have everything in my spiritual immune system I need to ward off fear and to hear what God's saying for me.
Yes.
Right. I mean, I think
that's solid.
Right. So I want to thank you. I know I need to honor your time here. But this is just so rich to hear your knowledge, your wisdom on this, your faith perspective on it. And my prayer is that this is going to help thousands of people get things clear in themselves and start on our own health journey.
Great. Yeah, I hope so too. Yeah.
So thanks for your time. Is there anything last that you want to add here as we wrap it up?
No, I think it's, be okay with taking full on responsibility. I think that's extreme responsibility, that is the most powerful thing ever. And,
so good.
I don't want to.
That's powerful.
But yeah, really appreciate you. I know you got an audience. So I hope the audience is refreshed, and,
I know they will be. I know it's going to be very significant for folks, and you'll be able to find wherever this is posted. You'll be able to find a link to Angove Family Medicine if you're not connected somewhere, or if you're in the region and can. I don't know what kind of bandwidth Dr. Matt has, but this guy will help you change your life. So take responsibility, live in faith, not in fear, and make sure you're picking up the right food, right? Yeah. Not just physically, but spiritually, and what you're taking in daily in your life. Dr. Matt, thank you so much for your time. You're a tremendous blessing to many, many people.
Great. You're welcome.
Thanks.